When it comes to our vision, once it's gone, it can be tough or nearly impossible to get back, and that is especially true when we're talking about glaucoma. I'm at a Barnett Delaney Perkins Eye Center Surgery Center this morning talking to Dr. Christine Funke about glaucoma and how they can now treat it. Thank you for having us today.
Absolutely. Thanks for being here.
When we talk about glaucoma, it's something we've heard about, maybe our parents or grandparents have had it, but explain what it is and why it's such a danger to our vision.
Yeah, absolutely. So glaucoma is a disease that we know is genetic, and we also know it has to do with the optic nerve and the optic nerve getting damaged. That nerve is the cable between the eye and the brain, how the two talk. And the more damage that there is, the more irreversible loss of vision. And what's hard is that we don't feel that nerve damage and loss, and actually we don't even notice when the vision first starts to get taken from us because it's usually peripheral first. And so the best way to really kind of find out if there is glaucoma is going in and getting an annual check. That's the best way, because otherwise, very honestly, it is a silent disease. Yeah.
And you don't know it until you're kind of behind the eight ball with it, and you're struggling just to maintain the vision loss, right? And not let it get any worse.
Exactly.
Who's at high risk? If there's really, other than you said there's genetic factors, give me a couple of categories of people who might want to be more mindful of this.
So again, genetics, that's a big one. So if you've got a family history, people in the family who are losing vision, you maybe don't even know why, that's a really good start point to kind of understand people with glaucoma in their family. That's another, you better be coming in to just get looked at, because it really does run heavily in the family. We also see this in certain groups and categories of people. African American communities, this is a higher risk profile, and a lot of times that glaucoma actually runs a lot faster in that group. We can see it in Asian Americans as well, a certain kind of glaucoma that's for smaller eyes, so we call narrow angle. And then we can also see this in the native population. So it doesn't mean that we don't see this in a wide variety. So, you know, just because you don't fit into that small subset doesn't mean that you're not at risk. But again, that group does tend to have a little higher prevalence.
Risk. So get those eye checks and be mindful of it. When it comes to treatment, it used to be drops several times a day, every day, forever, right? Now you guys have the technology on your side to make things a lot better.
That's the exciting part about being a glaucoma specialist, is we're really changing how we are treating patients. So it used to be we gave them a drop of whatever medication and then off you go and you were in charge of your own treatment. That's very hard to ask of people, to take something for the rest of their life or multiple things for the rest of their life. And we know that that's one of the biggest issues here is compliance, which is people stop taking their medicine and then we lose vision. We want to try and combat that. And so what we're doing now is we now have options that are low risk, minimally invasive procedures to get the glaucoma under control, and then you don't have to worry about remembering the medication. And they're really safe. Actually, if you look at the safety profile, a lot of times safer to do these minor procedures than to take medication for a long time. I know, which hardly anyone knows.
Wow,
It's fascinating. And one of the things that I have sitting next to me is called a DSLT. This is actually the first line treatment for the majority of patients I see. And it's because it is very safe, non-invasive laser procedure. This laser procedure is actually trying to heal the drainage structure inside the eye, which is one of the issues with people with glaucoma. And so what this laser does is it brings a little bit of very light, gentle energy into the drain. That is then going to bring the own body's healing cells to rejuvenate and make the drain start to function better again. Other things that we can do if this guy doesn't do enough is minimally invasive procedures in the operating room. So usually between a couple minutes of time, like cataract surgery, but instead of working on the lens in the eye, which is what most people think of with eye surgery, we're actually working in that drainage structure again to try and modify it with either putting medications into the eye at the same time that last for several years, putting little stents in, cleaning out the drain. We have a lot of really great options, and all again extremely low risk.
I love it. It's always incredible to me, the technology and how it's helping people, again, because you don't want to lose your vision any more than you already have when it comes to glaucoma. Doc, thank you so much for the information. Barnett Delaney Perkins has locations throughout the valley. If you'd like more information, call 602-456-2986 or visit goodeyes.com.